Bonjour tout le monde. Today, Minister Garneau will be joined by Ministers Champagne and Minister Blair and Minister Hajdu to make some brief remarks before taking questions. Nous entendrons d'abord de brèves adresses de la part de nos participants qui seront suivies d'une période de questions et de réponses.
Participants
Minister
will make
Garneau,
brief statements.
over to you.
Then there will be questions and answers. Minister Garneau.
Thank you very much. The COVID-19 pandemic is far from over. We need to continue to be vigilant and we need to continue to take action. The Government of Canada has put in place a number of measures to protect Canadians during this pandemic, and we have adjusted our actions as the pandemic has progressed. This includes taking action to reduce the risks of spreading the virus by air travel. On December 31st, we announced that anyone flying to Canada from abroad must have a negative COVID-19 test prior to their scheduled departure to Canada. With an interim order under the authority of the Aeronautics Act, this requirement has now been formalized. Given their critical role in applying this requirement, we have been in ongoing communications with airlines in recent days regarding the details. À compter de ce soir à minuit, heure normale de l'Est,
As of tonight at midnight Eastern Standard Time, in order to board a flight bound for Canada, travelers must show proof of a valid negative test result, a COVID-19 PCR test. This applies to all travelers 5 years of age or older. The test must be taken within 72 hours prior to boarding a flight bound for Canada. This applies to all travelers, whether they are Canadian or foreign nationals. There will be very few exemptions. One exemption, though, is flight crew. We understand that there may be difficulty obtaining tests for those traveling from some countries. For those traveling from South America and the Caribbean, until the 14th of January, tests can be taken within 96 hours of boarding a flight. There is more information at the government on the Government of Canada's website. Travelers traveling from Haiti will be exempt from this requirement until January 21st.
Additional information at travel.gc.ca or by contacting Canadian Consular Services. They can also contact their travel service provider. This new interim order will provide an additional layer of protection for Canadians and travelers. Many other existing measures were already in place for air travel to Canada, including mandatory face masks, temperature screenings at the point of departure, a health check for symptoms prior to boarding, and a reduced number of Canadian airports receiving international passenger flights. And travelers entering Canada must still complete a 14-day quarantine or isolation period under the Quarantine Act. As we have been saying for months, and I cannot say this strongly enough, non-essential travel continues to be strongly discouraged. The Government of Canada is
determined to continue to protect the health and safety of all Canadians. We continue to assess public health risks. We are working to ensure that we limit the spread of COVID-19 in Canada. Thank you very much.
Minister Champagne?
Oui, alors bonjour tout le monde et
hello everyone.
avec nous aujourd'hui.
Thank you
everyone
for tuning in today.
attending this press conference. The decision to implement the pre-boarding negative testing measures was not made lightly. While we recognize that these measures may cause inconvenience and frustration to Canadians traveling back to Canada, we are doing and will always do what is necessary to help protect the health and safety of all Canadians. Our messages to Canadians has been clear since the beginning of the pandemic. We strongly recommend to avoid all non-essential travel outside of Canada. Given the increase in the number of cases here, at home, and around the world, health guidelines are changing rapidly. We are seeing in many countries put in place tougher measures and imposing stricter lockdowns to slow the spread of the virus. As we have been saying, those who decide to travel may face fewer transportation options that will make it harder to return to Canada. And in some cases, this could mean staying abroad for a longer period than expected. It is for these reasons that we again remind Canadians that this is not a time for leisure travel abroad. Suite aux mesures annoncées, les Canadiens à l'étranger devraient déjà
Canadians who are outside of Canada should immediately begin to research places to get a COVID test before boarding their flights. If they need help, Canadians can ask local authorities. They can also contact air carriers or tour operators. Canada's consular offices abroad can also help Canadians and help them find places to obtain a COVID test. Canadians who require emergency assistance should communicate with the closest consular office or embassy. And of course, continue to check Canada's travel advisories. We will continue to offer consular services to Canadians who require them. I must reiterate, though, as we've been saying, that there will be no repatriation flights. None are planned at this point. We have been issuing travel advisories. We have been communicating the risks of travel, including health risks. There could, at any time, be changes in rules, restrictions on mobility, or travel abroad. The Canadian government may not be able to cover your medical costs or your travel costs. Consular services could also be limited.
To emphasize the need to stay in Canada. Now is not the time to go on holiday abroad. And as I've said many times, we can get through this challenging time together if we all do our part. And I count on all Canadians to do so. Merci tout le monde.
Thank you all.
Thank you, Minister Champagne. Minister Blair?
Thank you very much, Mary Liz, and I am very pleased today to have the opportunity to join my colleagues. And let me begin my remarks by repeating what Ministers Garneau and Champagne have already very clearly articulated. We repeat, our strongest advice is against all non-essential international travel. And as Minister Champagne has said, now is not the time to travel out of Canada for vacation purposes or any non-essential purposes. We have read many reports of travelers returning home to Canada, and Canadians are understandably concerned and upset about these travelers. Some are returning from sunny vacation destinations or elsewhere in the world where COVID is present. Our top priority has to be the health and safety of all of Canadians. That must be a top priority for all of us. And since March, we have repeatedly urged Canadians not to travel. We began with advisories in January and implemented enhanced screening and travel advisories for those places in the world where the pandemic or the COVID was present. But as we saw it spread around the globe, we took additional significant and strong measures. We implemented, in fact, some of the world's strongest border restrictions to prevent the spread and to slow its spread in Canada. We implemented, for example, restrictions on and banned all non-essential travel globally. We took the unprecedented step of closing the Canada-US border to non-essential travel while maintaining essential supply and essential work. We, through our Public Health Agency of Canada, implemented quarantine orders, have conducted testing pilots, tracing, and enforcement of those quarantine orders. And the measures that we have taken are working. We have seen a more than a 90% reduction in travel globally around the country and international arrivals at our borders. And this has resulted in less than 2% of all COVID transmissions in this country have been related to travel. But we cannot ease our vigilance at our borders. And now we've added an additional layer of protection, as Minister Garneau has outlined. As he announced, anyone 5 years of age or older is now required to test negative for COVID-19 before traveling to Canada. This new testing requirement will help prevent further introduction and transmission of COVID-19 and new variants of the virus into Canada. I want to be very clear, though, these measures do not replace those strong and effective measures that we have already put in place. I'd point out that the quarantine measures put in place by the Public Health Agency of Canada are our most effective defense. And if you enter the country for non-essential purposes, you must quarantine for 14 days. As Minister Garneau has said, preventing air travel from being a source of spread is a crucial step forward in controlling the virus in Canada. And if you are returning to Canada from any destination outside of the country, here's a reminder of what you can expect. First, you will need to take a COVID test within 72 hours before you board a plane to return to Canada. Until January 14th, travelers originating from specific countries where testing capacity is scarce and for which the 72-hour window is not feasible, it may be tested up to 96 hours before your scheduled departure. At the airport at the time of checking in for your flight, your airline will take your temperature, ask you questions, including if you've been exposed to anyone with COVID, and make sure that you are not exhibiting symptoms. Next, you'll need to submit the health questionnaire and quarantine information through the ArriveCan app or the ArriveCan web portal. Unless you are in an exempt group, you will be required to submit information digitally, no matter how you are crossing through the border, by air, land, or by water. And when you arrive at the border, at any point of entry, you'll be subject to screening and security measures. You will also notice an increased CBSA presence at the 4 major international airports. Since the end of December, we've added 230 additional border service officers. They've been assigned to customs halls, baggage areas, and around primary inspection lines. And they will ensure that all travelers understand their quarantine obligations, and they will verify your quarantine plans. You will also see an enhanced public health presence at all points of entry with over 180 additional federal public health officers present across the country. And no matter where you are coming from or where you enter Canada, once you arrive, you will be required to quarantine for 14 days. And once you have reached your quarantine destination, public health officers will be in touch with you to make sure that you continue to quarantine for 14 days. I want to remind all travelers that there can be no excuse for breaking the quarantine rules. Police services of police of jurisdiction are standing by and ready to enforce the rules as they have throughout the pandemic. And as I've already mentioned to you, the consequences of breaking those rules can be quite significant, with substantial fines or even the possibility of prison time. But more importantly, there is not just a legal obligation, but a moral one. In order to protect your family, your friends, and your community, it's absolutely essential that Canadians obey the quarantine orders and fulfill their requirements to keep themselves and others safe. Lives are at stake. We have already lost far too many people, and that's why we continue to urge all Canadians not to travel unless it's absolutely necessary to do so. And if you do travel, you must obey the requirements of the quarantine orders put in place. We'll continue to work all of our partners using science and evidence to inform all further steps to keep Canadians safe. Thank you.
Thank you, Minister Blair. Minister Hajdu.
Well, thank you very much, and good afternoon, everyone. In addition to the pre-departure requirements that my colleagues have detailed, I can also confirm today that a joint testing pilot program from the Government of Canada and the Government of Ontario will be starting at Pearson Airport. International travelers arriving at the airport will be able to get tested for COVID-19. The program will be voluntary. All international travelers will continue to require to follow the federal mandatory 14-day quarantine after arriving in Ontario, regardless of if they have a negative or positive test. The Government of Ontario will share more details this afternoon on the project, but international travelers can register to participate in the program at torontopearson.com/testing. Similarly to the pilot currently ongoing in Alberta, this science-based program will generate evidence that provincial and federal governments can use and that will help inform the development of future testing programs. Now, as more people become infected with COVID-19, more people also become hospitalized, and of course, we see, sadly, more people die. So stay home, cancel your travels if not absolutely necessary, and help out wherever you can. Now is the time for all of us to double down on kindness and compassion. Let's continue to look out for each other as we get through these next few tough months together.
Thank you, Minister Hajdu. We'll now open the floor to questions. As a reminder, please limit yourself to one question and one follow-up. Please begin your question by identifying yourself and naming the media outlet you represent. And please let us know who you're directing your question to. Operator, please proceed with our first question.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. And the first question, la première question est de David Youngren from Reuters, Ottawa. Please go ahead. La parole est à vous.
Yes, thank you. First question, what is happening to the ban on UK flights, which expires at the end of today? Is that being extended? Is that going to be allowed to expire? Are you lifting it?
So I can take that one. Thank you for the question, David. The NOTAM, or the ban on UK flights, which was going until midnight tonight, will lapse. It will no longer be applicable. We've made that decision based on the fact that we have now put in place, since that original ban, a pre-departure testing protocol that we've just described at length. And so that will replace the ban that existed for the UK, and it applies, of course, to all countries in the world from which flights may come to Canada.
And secondly, the airlines say this is too onerous and they're going to suffer. What do you say to people in the airline industry who are unhappy with these measures?
I think that the airline industry has worked remarkably well with the Government of Canada throughout the past 10 months in terms of putting in place processes to ensure the highest degree of safety for Canadians, with whether it's wearing of masks, whether it's their air control systems on board, whether it's taking temperatures, asking questions. We are now asking them to put in place an additional requirement. And we have been in touch with them for the past week, and we have been working out the details with them. And we are confident that they will rise to the occasion and be able to apply this new interim order as of midnight tonight.
Operator, next question.
Thank you. The next question, la prochaine question est de Lina Dib de la presse canadienne.
Next question, Lina Dib, La Presse Canadienne.
Oui, bonjour. Ma question
Hello.
est pour vous, Monsieur Garneau.
My question is
Désolée
for
que c'est
Minister
sur un autre
Garneau.
sujet, mais je suis sûre que mes collègues vont s'occuper de ce sujet-ci. On n'a pas souvent l'occasion de vous parler.
We
C'est à propos
don't
de la
often
transaction
see
avec
you at press
Air
conferences.
Transat.
It's
Je
good to
sais
be
que
able
vous êtes
to ask you a
encore en
question.
train d'étudier la
Now,
chose.
it's
Alors,
about
je veux
Air
savoir
Transat. I know that
pourquoi
you're still
ça prend
studying the
encore autant
details,
de
but
temps
here's what
avant
I'd like
de
to know.
décider si vous
Why does
l'approuvez
it
ou pas.
take so
Et aussi,
long to
est-ce que
decide
vous
whether or
saviez
not
qu'il y avait
you'll
une
approve?
seconde offre
Furthermore, did
qui
you
a été
know
éventuellement
that
refusée pour
there
Transat?
was a second offer? Was there a second offer for Air Transat?
Merci pour la question, Lina.
Answer, Minister Garneau. Thank you for the question, Lina. Transport Canada's responsibility, my responsibility, is to determine whether the purchase of Air Transat by Air Canada is in the public interest. The file has evolved throughout the year because of the pandemic. The pandemic has had many consequences on the air travel sector. We are very close to making a decision. I don't have an exact date, but we will be making our decision based on the public good and interest. Follow-up, Lena Dib. Did you know whether there was a second offer for Air Transat?
It's about this vaccination of inmates. The correctional service is the guards. I'm sorry, my English is missing here. The guards are asking to be vaccinated first instead of vaccinating the inmates because they're the ones who eventually would be bringing the COVID inside the prisons. So I wanted to know what's your take on that.
Juste pour répondre rapidement.
Answer, Minister Garneau.
Bill, the second part of that question to me. Je dirais simplement, Lina, qu'on est très conscient de la situation.
Lina, we are very aware of the situation. We have been closely following the matter. We have been seized with the matter for 9 months. That's all I have to say for now.
Thank you, Lena. And if I just may respond to the issue with respect to the inmates in correction institutions, we are following the advice of the National Advisory Committee on Immunization, which identified those who were living in congregate living center locations, such as our federal institutions, as high-risk locations. And frankly, I understand the concern of the union representing our correction officers and the risk that they experience. And the National Advisory Committee on Immunization has identified both correction workers and inmates as on a priority basis. But they've also identified that certain individuals who live in a congregate living setting like long-term care facilities or our prisons, who are elderly and have underlying health conditions, must be a priority for the issuance of the vaccine, and that's why we in our very earliest distribution of those vaccines, we're making a small number of those vaccines available to those individuals who are particularly at acute risk in our federal institutions. We have a duty of care for those who are in our custody to ensure that they are treated fairly and that they are kept safe. And I think that's also very much in the interest of those correction workers who are in those institutions, that we take the steps necessary to protect the most vulnerable people in those institutions, and also provide protection to those frontline healthcare workers who are working in our federal institutions to deal with those individuals who are living with those underlying significant health risks. And so we are following the advice of the Advisory Committee on Immunization, and we are working very diligently to ensure that the vaccine is made available to those who are at greatest risk.
Thank you, Minister Blair. Operator, next question.
Thank you. The next question, la prochaine question est de Abigail Biman from Global News. Please go ahead. Your line is open.
Hi, ministers. We've been getting a lot of questions from people in the United States who say that PCR tests are taking between 5 and 7 days to get back. What do you say to those people who can't get a test in that 72-hour window? I don't see anything about the U.S. on the list of exemptions.
I'll just answer very quickly and pass it to my colleague, Minister Hajdu. But just to repeat what we said was that we recognize that in certain cases, and there is a list of 24 countries, and that list is available on our website, of countries where it's may take a little bit more time in order to get the test and to get the results. And so we've extended that temporarily from 72 hours to 96 hours. But I'll pass it over to Minister Hajdu.
Well, I don't have too much more to add other than to say that this is exactly why we're advising people to not travel internationally. It is difficult to acquire a PCR test in countries that you wouldn't suspect that it's difficult to acquire one. And you're talking about the United States. The reality is that COVID is raging in countries all around the world, and people are using domestic tests to contain their outbreaks. And so it is very important that people follow the travel advice and resist the urge to travel internationally if not absolutely essential to do so. Because the reality is they may find it difficult even in countries that have PCR testing capacity to acquire a test within the required time frame.
Thank you. Next question, or Abigail, follow-up?
Yeah, I specifically asked about the U.S. because it's not on the, I'm reading your website right now and the U.S. isn't listed there. If there's anything to add, I'm also wondering if this is something you're going to move to institute at land borders as well, the negative test requirement?
Well, very quickly on the United States, we consider that it is perfectly reasonable within 72 hours to get a PCR test and to get the results. And I'll pass it over to Minister Blair on the land borders.
Yeah, we saw as a priority, it's very difficult actually for Canadians to travel by land into the United States because the United States has reciprocal restrictions on non-essential travel. So the vast majority of Canadians who would be traveling into the United States for vacation purposes are doing so by air. And that's why we've placed a priority on these measures for air travelers. But we've been conducting a number of different pilots, one at Coutts, Alberta. There are a number of other discussions taking place, as Minister Hajdu has already mentioned, and certainly we are examining additional layers of protection that could be put in place, but as of today, the measures that we have implemented is for, I think, what is the higher risk, which is international travel.
Maybe I can just add that the pilots that we're proceeding with, first with Alberta, now with Ontario as announced today, and other provinces that may wish to proceed on these pilots, is also generating really helpful evidence about the blend of testing, when it is ideal to test, and how that may or may not be useful to shorten quarantines. Of course, we are all hopeful that we'll be out of this pandemic sooner than later and travel will resume at some point. And the evidence that we need in order to make sure that we continue to have secure and safe borders, as well as protect Canadians who are traveling from the importation of COVID to their loved ones and their communities, that evidence is going to be very helpful as we plan future measures.
Thank you, Minister Hajdu. Operator, next question.
If I may add.
Sorry about that. Go ahead, Minister Champagne.
No problem. I think we had exhausted for those who might be in the United States, as my colleagues have said. I just want to say for public information to direct Canadians to what we have created travel advice pages for about 80 countries where Canadians who might be in these jurisdictions will find useful information that direct them to the local, if you are in the United States, state authorities and county authorities to make sure that as much information is available. We've been in contact with our counterparts in a number of countries, and we'll continue to make information available to Canadians who might be in these jurisdictions, despite our advice to avoid all non-essential travel.
Thank you, Minister Champagne. Operator, next question.
The next question, la prochaine question est de Mélanie Marquis de La Presse. Please go ahead, your line is open.
Mélanie Marquis, La Presse. Question.
Merci. Bonjour, ma question est pour Monsieur
Thank you.
Garneau.
My question is for Minister Garneau and perhaps for Minister Champagne as well. Could you give us some international perspective? Why are we not instituting a complete travel ban on international travel, especially given the COVID-19 situation in Canada and around the world? Answer, Minister Garneau. Well, there are legitimate reasons we haven't instituted a travel ban. These reasons can be professional or personal. People have valid reasons to travel in some cases. That's why we are not completely closing our borders. And now my colleague, Minister Champagne, will answer. Minister Champagne. Happy New Year, Ms. Marquis. Thanks for your question. Canada has taken some of the strongest border measures of any country. No country in the world has completely shut its borders because, as my colleague just said, there can be exceptional or extenuating circumstances that require travel. Today, we are announcing additional measures to protect the health and safety of everyone. we are implementing measures that are even stronger, even stricter. Our measures and actions are aligned with those of European Union countries and of other countries in the world. As Minister Hajdu has said, since the beginning of the pandemic, we are constantly adjusting our measures and fine-tuning in order to take necessary action. Today's announcement is an additional layer of protection, and we will continue to follow the situation closely to act as needed. Follow-up question, Mélanie Marquis. My question is for Minister Garneau. Air Canada has contracted influencers to encourage people to travel. What do you think of that? Is that sort of contradicting all of your efforts? Answer, Minister Garneau. We have been stating very clearly since the 13th of March that Canadians should not travel abroad for non-essential purposes. We continue to reiterate that message. If you return to Canada, you will have to quarantine. Now, there are new variants. There's the UK variant and the South Africa variant. These additional new measures are absolutely necessary. I feel that it is totally unhelpful and counterproductive for airlines to try to encourage international travel. Many Canadians are making sacrifices right now. So many Canadians could have traveled this year. However, they decided not to, because that's what is better for Canadians, for Canada, for their health, for the health of their loved ones. Canadians are making sacrifices. The situation is very difficult. It's a shame that we can't travel. That said, airlines shouldn't be encouraging international travel.
Thank you, Mr. Garneau. Operator, next question.
The next question, la prochaine question est de Boris Proulx, du Devoir. Please go ahead.
Boris Proulx, Le Devoir. Question.
Oui, bonjour. Ma question s'adresse au ministre Champagne.
Hello.
Tout à l'heure,
I have a question for Minister Champagne.
des raisons légitimes de voyager.
Earlier, you mentioned legitimate reasons for travel. Where do you draw the line, though? What is a legitimate reason for travel? For example, visiting a sick family member, managing property abroad, helping a child move abroad, attending a funeral. What is legitimate? What is essential? Answer, Minister Champagne. You know, it's hard to legislate on that. As Minister Garneau said, our message has been clear, and we have repeated it constantly. Our federal, provincial, and territorial partners have continued to state that international travel should be avoided. As Minister Garneau said, some people have had to cross the border, for example, to bring or transport essential goods into our country. That said, we have issued very clear warnings to travelers, travel advisories, since mid-March, saying to avoid international travel. Why would people take that risk? When you travel, you have to come back and quarantine. You are putting yourself, especially those in your household and those in your community, at risk. We should have respect for our frontline workers, for our healthcare workers. We must avoid non-essential travel. But it is very hard to draw the line and to legislate on what is and is not legitimate. Follow-up question. This question is for Minister Garneau. There have been cases of COVID at the Montreal airport. There are COVID cases on both domestic and international flights. When it comes to discouraging non-essential flights, are they discouraged for domestic flights as much as for international flights? Answer, Minister Garneau. When we say non-essential travel, non-essential flights, That applies to all movement, all travel. We need to use common sense, basic common sense. Whether we're traveling abroad and then returning to country, or whether we're traveling within Canada from one area to another, it is possible to spread COVID-19. It's important to determine whether it's really and truly essential to travel.
Thank you. I'll note that we have about 10 or 15 minutes left, so we'll continue now with the next question over the phone.
The next question, la prochaine question est de David Thurton from CBC News. Please go ahead. Your line is open.
Hi, thanks. Just wanted to ask you this question. We're hearing from some people who have no problem getting a PCR test, but there is some confusion over the quality and acceptability and even the documentation that comes with certain PCR tests that are received abroad. And there are confusions about, with among these passengers about whether, that this documentation, these tests will be sufficient when they arrive at the airport. And apparently they aren't getting any, the airlines aren't answering their questions. So I'm just wondering, what do you have to say about this? And also, do people who are vaccinated, do they still need to get a PCR test if they're traveling back into Canada?
Minister Garneau, you're on mute.
Thank you. I beg your pardon. To answer the second part of your question, whether you've been vaccinated or not does not remove the requirement for you to get the pre-departure COVID-19 PCR or LAMP test. The reason for this is that the science is not yet clear on whether somebody who's vaccinated is not going to be able to transmit COVID-19. So the requirement for the pre-departure test still applies. With respect to the requirement to present to the airlines, it is a valid test result that has certain information on it that says when the test was taken, what the result was. And we are also at the moment working very hard, and perhaps my colleague Minister Champagne may wish to add to that, but they're doing a lot of hard work to identify the different facilities in the different countries that are, for example, accredited laboratories. And at some point in the future, we may narrow down the requirement to go to certain accredited labs.
So can you guarantee that a passenger who shows up at the airport tomorrow with a PCR test that has the date, that has the information that you just mentioned, Mr. Garneau, that they will be allowed to board, that they won't face any issues? Can you just clarify that?
The answer is yes. If they have got the piece of paper, or if it's electronic that contains the information which I just described to you, then they will satisfy, at the moment, the requirement. And we are getting more specific as we are doing our research on the locations in the different countries where accredited lab facilities do exist, and we may require certain labs to be used in the future.
Thank you. Operator, next question.
The next question, la prochaine question est de Cormac McSweeney from City News. Please go ahead. La parole est à vous.
Hey, my question is for Public Safety Minister Bill Blair, and it's just about the prison vaccinations again. Premier Ford, in his news conference just before you were speaking, slammed the federal government for giving vaccines to what he says are dangerous criminals in prison rather than preferring to give them to long-term care residents first. Can you respond directly to Premier Ford's criticisms, which mirror the criticism we've heard from Conservative leader Aaron O'Toole? And as well, he wants the federal government to change this decision. Is there any thought at all to make any alterations to vaccinating inmates?
Yeah, thank you, Cormac. Let me be really clear on something. First of all, I think that all of us, including the province of Ontario, have a lot of work to do to make sure that we have, an efficient and effective rollout of the vaccine for all of those who need it. I would also simply remind the Premier and the Conservative leader that, frankly, the language of resentment and fear really has no place in this discussion. It really needs to be based on the advice of our public health authorities. The National Advisory Committee on Immunization was very clear in identifying people living in congregate living situations like a long-term care facility or in like our federal institutions, and prioritize those individuals who were elderly, had pre-existing health conditions, and therefore were particularly vulnerable. There are a small number, but a number of people in our federal institutions that meet that criteria. And so we have a responsibility for those who are in our custody. I'm pretty familiar with, as you know, Cormac, with our responsibility that we have the people that we take into our custody and who are now in our prison system. And we have a responsibility there to make sure that we provide them with appropriate and adequate care and apply exactly the same criteria that the National Advisory Committee on Immunization has articulated for them as they have for all other Canadians. The advice of the Advisory Committee was to prioritize our detention, our custodial institutions for both inmates and for those workers that were working there. And in subsequent phases of the rollout, we will follow that advice. But we also are following their advice to prioritize those people who are in congregate living settings. And as you can imagine, in a prison, socially distancing can be challenging. We've had a number of outbreaks in our institutions, and although Corrections Services Canada has taken very effective and aggressive measures to control those outbreaks, we know that certain people in those environments are high risk. And there are people in our federal institutions who are elderly, have pre-existing health conditions, and other conditions that make them far more vulnerable. And that's why we've prioritized them. And I would also identify that there are healthcare workers working in those federal institutions who are also being prioritized, exactly as we have done with healthcare workers working in our long-term care facilities. And so this is not, as has been suggested, unfortunately, by some, a rollout of the vaccine for all federal inmates, only those which the National Advisory Committee on Immunization has identified as being particularly high risk and therefore a priority for the distribution of this vaccine.
And just as a follow-up, I'm wondering if you could confirm some numbers. The Union for Correctional Officers has said that beginning Friday, the plan is to immunize up to 600 federal inmates who fall into that category that you mentioned. Can you confirm that number, that it's up to 600 that you're looking at? As well, can you give an update on the status or the numbers for how many inmates in federal prisons have contracted COVID-19, have died, and how many facilities have been impacted by outbreaks?
Yeah, I actually do have some data on the outbreaks that have taken place in our federal institutions. There have been several of our federal institutions that have been impacted. 3 of them at the moment in Saskatchewan, Manitoba, and Ontario are experiencing fairly significant outbreaks. So far, 3 federal prisoners have tragically died as a result of these measures. But I want to reiterate that Corrections Services Canada, working with the Public Health Agency of Canada and the local, provincial, and regional health authorities, have been very, very aggressive in their response and doing everything possible to protect that inmate population for whom we have a responsibility and a duty of care. And so we have been working very hard to limit the introduction and the impact of COVID in those institutions, because as congregate living environments, they're pretty risky. I can tell you that we identified a small portion of vaccines that could immunize up to 600 prisoners. I don't have a precise number right now. The Corrections Services Canada is working with the Public Health Agency of Canada and the local, provincial, and regional health authorities to identify those individuals most at risk, and that includes elderly, inmates with pre-existing health conditions that put them in that category as very at risk, as well as healthcare workers working in those institutions. And I would also just remind people that those institutions don't exist in total isolation. They exist within communities. The corrections workers who come and go from those institutions every single day also live in our communities. And so we have a responsibility not only to protect those inmates, but protect the corrections workers and the communities from which they serve. And that's why it's very important. We've identified this as a high risk environment, and we haven't done that just arbitrarily. We've done it based on the advice of the National Advisory Committee on Immunization. We've accepted their advice in prioritizing those individuals who are most at risk. And we will be moving forward on that advice exactly as we have done and as I'm very hopeful that the provinces are also doing in identifying those people who are most at risk as priority for the earliest administration of those vaccines.
Thank you, Minister Blair. Operator, next question.
The next question, la prochaine question est de Hélène Buzetti du Devoir. Please go ahead. La parole
Hélène
est à vous.
Buzetti, Le
Yes,
Devoir.
hi, Minister Blair.
Question.
I just want to follow up on Cormac's question. So you mentioned the 600 number. So does that include healthcare workers working within facilities, or does it not? Because when we speak to the union, they say that healthcare workers working within the facilities have been told that they have to be vaccinated in their community following the priority list of that community.
Yeah, and no, thank you for the follow-up question. I understand, quite frankly, the concern of the union advocating on behalf of their members. They want to prioritize their correction officers for the vaccine because they're working in what has been identified and clearly is in fact a high-risk environment. And I want to assure them that the National Advisory Committee on Immunization has identified as corrections facilities and correction workers as a priority in the second phase of the rollout of the vaccine. And we'll be working with the local provincial health authorities to deal with that at the appropriate time, but certainly as a priority. But we have also acknowledged that there are some individuals within our federal institutions who are elderly, who have existing health conditions, and as a consequence are at a much more significant risk. And it's very similar to those individuals, elderly individuals living in work and living in long-term care facilities have been made a priority, but again, based on the advice of the NACI. Having said that, it's also important that if we have workers who are identified as dealing with those individuals and therefore at greater risk, then they would also be prioritized. But I'd also point out, when someone becomes seriously ill in our federal institutions, they don't receive treatment within the institution. They take up an ICU bed in the hospital in the local community. And therefore, it's very important that we deal with those individuals at greatest risk of getting the COVID and at greatest risk of having serious health consequences as a result of acquiring, quote, COVID. And that's clearly been identified by the National Advisory Committee as those individuals who are both elderly and have pre-existing health conditions. There are some people in our federal institutions that meet that criteria, and we're making sure that they also have access to those vaccines. I just simply remind all of us that those individuals, when they come into our custody, are also our responsibility and our care, and that we have a responsibility to make available to them exactly the same level of protection that we are doing to others who are in similarly vulnerable situations.
And well, as a follow-up, you haven't really answered my question. It's not clear to me if the health workers within the institutions are included in that 600 number. But I just wanted to follow up. Those 600 inmates that will be vaccinated, are they located only one facility or in many facilities? Can you provide the list? And also, what proportion of elderly inmates does that represent? Do we only have 600 inmates, or is it less than that, more than that? Can you just give us a sense of magnitude, please? Thanks.
Yeah, thank you for the follow-up. And just so I may assist, there are approximately 13,000 people in our federal institutions and about 9,000 people in community settings as well. But of the 13,000 in the prison system, the amount of vaccines that are potentially available, I don't have, by the way, a precise number. They're not located in one location. They are scattered throughout the population of our institutions, and it represents less than 5% of the total population of those institutions. And so we've identified, and Correction Services Canada is identifying inmates who are both elderly and have pre-existing health conditions that puts them at a much higher level of risk than the rest of the inmate population. And we are taking the steps necessary and appropriate to protect those individuals. And for others, they'll simply wait their turn, as every other Canadian must wait their turn.
Thank you, Minister Blair. Operator will go to the last question over the phone.
Thank you. The next question, la prochaine question est de Ryan Tumulty from the National Post. Please go ahead. Your line is open.
Yeah, hi, this question's for Minister Champagne. I'm wondering if we can get your reaction to the arrests in Hong Kong today. It seems like the widespread arrest of anyone who is advocating for democracy there.
Yeah, thank you. Thank you for the question. It's very concerning, and for me, it's yet another sad example of the further erosion of the one country, two systems. And we've seen a number of concerning cases since the imposition of the national security law in Hong Kong. I've been in contact with allies this morning, and certainly will be following the situation very carefully. As you know, we have a vested interest in what's going on in Hong Kong. We have about 300,000 Canadians. But I must say, to me, it's yet another example of the further erosion of what was the basic law in Hong Kong, but also the one country, two systems.
Follow-up, Brian?
Yeah, I guess, sorry, just as a follow-up then, what sort of reaction do you plan for Canada in response to this, along with everything else we've seen China do this year, the ongoing hostage diplomacy? Is there going to be a stronger Canadian response at any point? And also, perhaps, can you say what you think this means for the safety of the 300,000 Canadians who are in Hong Kong now?
Well, we'll be working with our allies, and this has already started, as you would expect, in terms of the appropriate response. I just want to remind you, Canada was the very first country in the world to suspend the extradition treaty, to even suspend the transfer of sensitive equipment, to update our travel advisory, and even to come with immigration measures, which were very complementary to those that were put in place by the United Kingdom and Australia. So we'll be working with our allies. Like I said, I've been on the phone this morning. We will certainly come with one voice to express in no uncertain terms what we have seen and what we are seeing by China undermining the pillars that have made Hong Kong what it is, which a vibrant center for trade and commerce. And seeing what's happening right now, obviously, is of much concern. And like I said, certainly we will always be there for the 300,000 Canadians that are living in Hong Kong. And as you know, we have put additional measures, Minister Mendicino, in terms of immigration. So we'll be following the situation very carefully and be certainly coordinating our actions with our allies around the world.
That's all the time we have for today. Thank you all for joining us.
Merci tout le monde.